cases of COVID-19 in Canada, including 9,032 deaths. 89% of people have now recovered. Labs across Canada have tested 4,840,043 people for COVID-19 to date. Over the past week, an average of 43,000 people were tested daily, with about 1% testing positive. Based on the most recent 7 days, there have been an average of over 380 cases reported daily from across the country. Last week, we presented the latest epidemiological and modeling data on COVID-19 in Canada and discussed being prepared for the fall. It's no secret that we'll continue to have cases, given that COVID-19 is circulating worldwide, but we also know that we have laid the groundwork to tackle these cases as they come, if we can all keep working together. Our progress in getting through the initial wave of COVID-19 in Canada showed our ability to persevere and adapt with a collective goal in mind. We made sacrifices and kept at it despite the hardships so that we could reopen at the safest time. Remember, treading cautiously, carefully down the mountain of the initial wave. The idea was to get the infection rate low and build up capacity that would allow us to reopen, while quickly responding to keep the epidemic in a slow burn scenario. This is still the scenario I'm hopeful we can maintain, where local public health are able to manage every new chain of transmission and not be overwhelmed with too many cases or too many contacts in an uncontrolled spread scenario. As schools across Canada reopen, I am confident that we have what it takes to adjust, adapt, and stay the course. We'll all need to keep up with our habits of physical distancing, washing our hands often, and wearing masks as appropriate, while also following local public health guidance and adjusting to adapted environments to reduce the risk of spread. Things will be different, and there will be uncertainties, but by proceeding with caution, we'll tackle these together to make sure our kids and our families can resume essential learning, social development, and activities we all enjoy. Thank you.
Bonjour. Aujourd'hui, je voudrais m'arrêter sur nos progrès et sur le fait que nous sommes parvenus à contenir la COVID-19 à un niveau gérable, tout en montrant que nous pouvons nous adapter pour relever les défis qui surviennent. Commençons par les derniers chiffres. On a signalé 122 872 cas de COVID-19 au Canada, dont 9 032 décès. Les personnes infectées, 89% sont rétablies. À ce jour, des laboratoires de partout au pays ont analysé les tests de dépistage de la COVID-19 de 4 840 043 personnes. Au cours de la dernière semaine, nous avons testé en moyenne 43 000 personnes chaque jour, dont environ 1% ont reçu un résultat positif. Sur les 7 derniers jours, il y a eu en moyenne plus de 380 cas signalés quotidiennement dans tout le pays. La semaine dernière, nous avons présenté les dernières données épidémiologiques et les derniers modèles sur la COVID-19 au Canada et nous avons expliqué que nous étions prêts pour l'automne. Ce n'est pas un secret que nous aurons d'autres cas, étant donné que la COVID-19 est présente partout dans le monde. Mais nous savons également que nous avons fait le travail préparatoire pour nous attaquer à ces cas au fur et à mesure qu'ils surviennent, si nous agissons tous ensemble. Les progrès que nous avons accomplis pour passer à travers la première vague de COVID-19 au Canada nous ont montré que nous étions capables d'être persévérants et de nous adapter en ayant un but commun à l'esprit. Nous avons fait des sacrifices et nous avons gardé le cap malgré les difficultés pour que nous puissions rouvrir l'économie au moment le plus sûr. Souvenez-vous, procéder avec précaution, faire attention, diminuer la courbe de la première vague. L'idée était d'abaisser le taux d'infection et de nous donner la capacité qui nous permettait de rouvrir l'économie tout en agissant rapidement pour que la croissance épidémique demeure lente. C'est ce que nous espérons encore, un scénario où les autorités de santé publique locales sont en mesure de gérer chaque nouvelle chaîne de transmission et ne sont pas débordées par un trop grand nombre de cas ou de contacts si la propagation est non contrôlée. Lorsque les écoles au Canada rouvriront, nous sommes convaincus que nous pourrons nous adapter et garder le cap. Nous devrons tous conserver nos habitudes de distanciation physique, de lavage des mains fréquents et de port de masque quand il le faut, tout en respectant également les directives des autorités de santé publique locale et en nous adaptant aux différents environnements dans le but de réduire le risque de propagation. Les choses seront différentes. Et il y aura des incertitudes, mais en procédant avec précaution, nous lutterons ensemble pour que nos enfants et nos familles puissent reprendre leurs activités d'apprentissage essentielles et de développement social et les activités qu'ils aiment tous. Merci.
Thank you, doctors. We will now move to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics. We're going to change it up today and start in the room. So CBC, over to you.
Hi, it's kind of caught off guard there. Thank you so much for making yourself available. I guess the first question that I just have for you all is, there's a lot of talk about elections and possibly going to the polls during a pandemic. New Brunswick is certainly. Are you all involved in discussions with that? And if so, can you take us inside some of the things that you're thinking about? Maybe take us inside some of those conversations.
Maybe I'll start. We actually haven't been engaged in those discussions to date, but I do think that we have guidance in terms of public health measures and recommendations and how to do things in as safe as possible manner as we can. So if you were talking about, people going in person to vote and that type of thing, then I would expect that any setup respects the public health recommendations in terms of physical distancing, mask wearing indoors, hand hygienic measures. All of those things have to be in place to safely, I think, conduct elections. Okay. And I think, obviously people explore other maybe technological advancements that allows you to maybe not attend. I don't know where that's not within my area of expertise or scope, but all of those kind of new ways of doing our regular daily activities or business have to be explored, I think.
And when you say that you haven't been involved in conversations, is it just, Dr. Tam, that you haven't been consulted or anything like that, or it's not in your purview jurisdiction, it's an Elections Canada thing? It just, yeah.
I think it's partly because it's we expect every setting, every business, every sector to already be preparing based on public health guidance. So if they haven't reached out, it's probably because they are looking at what they need to do in their own context in follow-up with local public health, provincial or federal. Most on-the-ground kind of activity in running any of these activities sort of really relate to local areas of jurisdictions from a public health perspective as well.
If I could just quickly ask, we keep hearing from you all and other, chief medical officers in provinces that they're seeing elevated cases among young people, among people my age. And then we hear that the marketing and the messaging to this group needs to change. Is there any update about when we might see the messaging or targeting messaging for young people that speak to them?
That's a really great question, and I think we can all do better. I know that from a federal government perspective, a lot of thought is being put into how we do this as it's happening right now. I think there's some new youth testimonials, for example, just youth speaking about their own experience with COVID-19 that was just posted and launched. And we have other initiatives that are, one is expected to roll out as we speak. I think it's really important to engage the input from young persons. These are the people with the lived experience, and that their ideas and the innovation is going to be really critical. I also know that young people are particularly good at engaging in the sort of social media domain, and that they have lots of ideas, and there's lots of youth influencers, I think, that can be leveraged as well. So we are also trying to, in addition to conducting sort of engagement with different groups in inputting into our messaging or our communication products, is actually leveraging behavioral insights and science in trying to change of those messages so that it is, it's appealing to the audience that we're trying to reach. And I think, we welcome ideas, I think, and innovation from youth and young adults. And if you have ideas, certainly we would like to hear about them. The other aspects is really about empowerment. I think as people go back to colleges, as people go to work in different settings, they can control their risk and minimize their risk and minimize spread. So I think, there's definitely proven things that we can all do. And that's the same message to youth, because I think the last thing people like to hear from, maybe people of a different generation is telling them what to do, when in fact, I think the answers actually come from youth and young adults.
Wonderful. Thank you, Dr. Tim. Operator, over to the line. Do we have any questions on the line today?
Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. And there are no questions registered at this time.
Perfect. Thank you. That concludes today's press conference.
Thank you. Merci. The conference has now ended. Please disconnect your lines at this time, and we thank you for your participation. La conférence